Good afternoon, everyone, and I hope that you're finding this year's annual conference knowledgeable and entertaining. It is my pleasure to present the Public Services webinar in today's virtual training. Next slide. I will go over some housekeeping notes just to begin the presentation. PowerPoint presentations and webinar recordings will be available on the HUD Exchange. Participants will be in listen-only mode. Closed captions can be viewed using the Show Captions feature below the video player. Consult the attendee guide for more information available on the resources page of the event website. Next slide, please. Questions. Submit content-related questions using the Q&A feature located below the video player. You may need to scroll down the web page to view the Q&A. You're encouraged to submit questions throughout the presentation. You do not need to wait till the end of the presentation to submit questions. Next slide. For technical issues, request assistance through the chat box on the right side of the screen. Additionally, questions relating to technical issues can be emailed to the email provided. Next slide, please. Slido. If you would like to access Slido while simultaneously viewing the event, an example without scrolling down, download the Slido app on your phone or go to the link provided in your web browser. Then type in the code for this session. The support team is posting the Slido code for this session in the chat. You can also scroll to the bottom of the page to find the Slido code in the session description. Next slide, please. And this is the beginning of the Public Services webinar. Eligible public service activities. There's a wide range of public services possible. These services include and related to employment, job training, crime prevention, public safety, childcare, health services, and also substance abuse services. Next slide, please. Eligible public service activities also include housing counseling under 24 CFR 5.100, fair housing counseling, energy conservation, and down payment assistance. Down payment as a public service is not limited to 50% of the down payment amount required by the seller. It also includes services for homeless persons, education, welfare services, services for seniors, and recreational services. Next slide, please. Public service costs. CDBG funds may pay for labor and supplies and also materials. CDBG funds may pay for operations and maintenance of facilities where public services occur. Payments must be directly related to the provision of eligible public services. I cannot just provide operational support to nonprofits, and you must document the cost. Next slide, please. Public service restrictions. The service must be 1, a new service, or 2, a quantifiable increase in the level of an existing service that has been provided by the grantee or another entity on its behalf with the local government funding or funding from the state to local government. In the 12 months preceding an action plan submission. Note, this restriction does not mean that a currently funded service organization needs to do more each year. This requirement is applicable to CDBG and CDBG-CV assisted public services. Next slide. Public services and religious entities. Generally, funds may not be used for religious activities. For example, no religious events or requirements to pray before a public service is provided. However, eligible public services may be provided through a religious entity if formal agreement in place stipulating 1, no discrimination or employment or participants, and 2, no religious instruction or counseling. Next slide, please. CDBG funds can be provided for minor repairs of facilities owned by religious entities that are used for public services. If 1, repairs are directly related to the public service activity. 2, repairs cannot be made where worship services are held. And 3, cost is only an incidental portion of the total CDBG money for public service activity. And this is applicable to CDBG and CDBG-CV. Next slide. Public services CDBG-CV. Eligible activities include, but are not limited to, job training to expand the pool of healthcare workers available to treat disease within a community. Provide testing, diagnosis, or other services at a fixed or mobile location. To increase the capacity and availability of targeted health services for infectious disease response within existing health facilities. Also to provide equipment, supplies, and materials necessary to carry out a public service. For example, food for food banks. Deliver Meals on Wheels to quarantined individuals or individuals that need to maintain social distancing due to medical vulnerabilities. Also, pay hotel room costs for vulnerable populations, an example, the homeless. Next slide, please. CDBG-CV funds may be used to provide emergency grant payments on behalf of individuals or families impacted by the coronavirus for items such as food, housing, emergency rental assistance, or mortgage assistance is included in the housing, or utilities for a period of up to 6 consecutive months. This is considered an eligible public service. HUD waived Section 105A8 of the HCDA and 24 CFR 570.207B4 to allow this assistance to be provided for 6 rather than 3 months. And this is in accordance to the August 2020 notice. Next slide, please. CDBG-CV assistance for emergency grant payments must be provided directly to the service provider on behalf of individuals and families. This assistance provided must be necessary and reasonable in accordance with 2 CFR 200.403 and 200.404. CDBG-CV grantees must document in their policies and procedures the amount of assistance they consider as needed. Next slide, please. CDBG-CV funds may be provided to nonprofit subrecipients or local public agencies to operate food banks that distribute food to individuals and families. CDBG-CV funds may be used to purchase additional refrigerators, freezers, or appliances to store additional food, and the food will be distributed to those impacted by the pandemic. It also includes the operating and maintenance costs of the food. Next slide, please. CDBG-CV public service activities. In accordance with April 30th, 2021 CDBG-CV tieback flexibilities guide, CDBG-CV grantees may carry out job training in communities or neighborhoods affected by coronavirus related to job loss since January 2020. Increase the capacity and availability of daycare or after-school services serving low mod areas in which parents have dropped out of the workforce since January 2020. Provide equipment, supplies, and materials necessary to carry out a public service related to the effects of the pandemic or to enable resilience to the effects of coronavirus in the future, such as food banks, youth services, healthcare, Wi-Fi, or senior services. Next slide, please. Ineligible public service activities. Income payments are ineligible, except emergency grant payments, and they are not to exceed 3 consecutive months. Payments made directly to a service provider is also ineligible. No ongoing operations as a standalone public service. For example, operating rental housing, different than paying to offer a service within the housing development, such as counseling. And last but not least, political activities are ineligible. Next slide, please. The public services cap. Annual obligations for public service activities may not exceed 15% of annual entitlement grant plus 15% of last year's program income. Calculated differently for states or per state. Exceptions: 1982 and 1983 grants, assistance to micro enterprises, job training, placement, or services with eligible economic development projects. Job training and placement by CBDO or 105A15 organization. Services by CBDO 105A15 under an approved strategy area, NRSA or CRSA. Next slide. There is the CDBG-CV public services cap. The CARES Act suspended the 15% public services cap for FY 2019 and FY 2020 CDBG funds and CDBG-CV funds used for public services to address coronavirus. This means that a grantee must use most or all of its CDBG-CV grant to provide public services to address the impacts of the coronavirus pandemic on its citizens. Next slide, please.
That was the last slide in the presentation, so I'm showing the Q&A.
Okay, thank you. So now the Q&A portion of our webinar, I am joined by Duncan Yetman. He will be assisting me with the Q&A. We are still continuing to take questions that will be answered throughout the remainder of the webinar.
So what do we have as the first question, Chelsea?
So our first question, is there a regulation or notice on emergency payments if they can be used for late fees? Wasn't quite understanding.
Okay.
A regulation or notice for emergency payments if they can be used for late fees.
Yeah. So this was addressed in part in the session that James Heyman, the director of the Entitlement Community Division, did on Tuesday of this week about CDBG-CV rental assistance. Late fees are ineligible with regard to emergency payments. We do ask that, and late fees are ineligible because they're ineligible at Part 200. So if you go to 2 CFR Part 200 and you look up under different allowable costs, and it lists different allowable costs, taxes, gambling expenses, entertainment costs, all the eligible costs are listed there in alphabetical order in 2 CFR Part 200. You'll see late fees. Late fees are not allowable. So that's why they're not allowable. There's no CDBG. Now, late fees are okay if it means the tenant is made current, but typically we don't want a grantee to be using to be paying late fees to a landlord. I think what James mentioned on Tuesday was that if possible, see if the landlord is agreeable to reducing the late fee from any subsequent payment made to that same landlord with regard to emergency payments for rent. for instance.
Okay, great. Thank you, Duncan. And the next question is providing computers via a lending program eligible. Would that be considered a supply or equipment?
This is Gloria. I guess it's my turn. Okay. Yes. If let's say that you're doing it for children so they can access virtual classes, is considered okay to do so for the purposes for children to continue their education. The grantee has to have policies and procedures in place to keep track of the computers, who they're given to, and when they have to be returned and where and so forth. Computers or laptops, or what these kids use, they Chromebooks, they're considered supplies because their cost is less than the cost of equipment, which is $5,000 or more. I mean, you can have a laptop that costs a few thousand, but if it's under $5,000, it's considered to be a supply.
Right. The changes to the uniform guidance, or when the uniform guidance was adopted, Part 200, it did make that distinction that Gloria mentioned between supplies and equipment, and put that $5,000 threshold in there. If it's more than $5,000, it's considered equipment. Prior to that, computers were considered equipment and had to be treated as such. But now they could be considered a supply if their cost is less than $5,000. Yeah.
Okay, great. Thank you, Duncan and Gloria. My next question, can you say more about spending funds for hoteling? What documentation is needed for this? And could you provide a regulation?
So spending funds for hoteling, I don't know if you talked about that in your public services presentation. Yeah, I mean, that would be, I don't know if that's an eligible public service, if that might be a housing cost.
Okay, I'm looking at.
Gloria, what's your thought on that one?
I'm presuming, I don't know for sure, that they're talking about paying hotel costs for homeless. There were grantees doing that in the beginning for, the pandemic, to get them off the street. They were using CV funds to put them up in hotels. And they did it for, I guess, a particular period of time. And so they would need to document that the person was homeless and that it was done in order to prevent the spread of coronavirus on the streets, because the homeless tend to congregate, in areas, even in the areas where they have the tent cities, for lack of a better term. And so to keep them social distancing from one another, and also, I guess, to protect them from the elements that would make them more susceptible if they have underlying health problems, they put them in hotels. And that was eligible at the very beginning. I haven't seen anything that says they can no longer do it.
Okay. All right. Thank you, Gloria and Duncan. I see in the queue that we've had some confusion when it comes to the situation of the question that was regarding the late fees. It says,
Yeah, I mean, Yeah, I mean, the questioner is correct that late fees are allowed to avoid eviction. But we don't prefer their, we would prefer that you work with a landlord and get them removed if possible.
Mhm.
Yeah, some landlords, you know, would do it, remove them because, I mean, you know, the people couldn't help that they weren't able to work.
Mhm.
So, like James probably said yesterday, they could negotiate with the landlord to remove the late fees. But if they could not, the reason that they can be paid to bring them current is because if you pay, let's say you pay the arrearage, but you leave off the $50 late fees for 6 months and they can't pay it. As far as the landlord is concerned, they're not current. They're still subject to eviction. So it's like you throw money away. So, you know, we've said in the past, if paying those late fees made them current, then sure. But to pay them as a standalone cost, definitely not.
Mhm. Okay. Duncan, do you have anything to add to that?
No, I don't.
I do know that a lot of states and jurisdictions, once you do meet the eviction process, they don't, fight for the late fees. When it's eviction, it's usually just rental payments that they are, receiving the eviction for. But you can't include the late fees in the amount that you're requesting that the tenant owes. This might be a housing question.
I wouldn't call it that. It's, I mean, in all fairness, you have landlords that are reasonable and willing to remove the late fees. I mean, they want, they need and want their money. I mean, because if they're not getting their money, they can't pay their mortgage.
Yeah.
So, they're willing to
here.
negotiate.
Yeah, I think what we're going to do here is we're going to shelve this discussion on late fees.
Okay.
And we'll work on a policy that will come forth from us to address that and to clear up any ambiguity.
Okay.
Okay, great. So I'm going to move on to the next question. Many people are testing at home and then missing work due to their positive test results. Can subrecipients accept photos of positive tests as proof of a COVID circumstance to pay rental assistance if they can show that they missed work and lost income during the same time period?
Usually if people test at home and test positive, if they are not hospitalized, they're generally not out long enough probably to lose money unless they're working for, maybe, I mean, some do work for restaurants and things like that. I guess where, you rely mostly on tips, and maybe some fast food workers. They probably can document that, but some employers and others require the PCR test, which is a little more definitive to demonstrate that you have a positive COVID test.
Yeah, I mean, yeah, I think that's true. Here's the thing. CDBG-CV rental assistance provided by they're documenting loss of income. They're not documenting positive test or non-positive test. What they're documenting is what we require within 570, 506 for a public service, which is the income of the person. If the person's present income is such that they can't meet their rent due to coronavirus, they need to show that evidence. I mean, and if they need that evidence, that should not be evidence that's provided necessarily alone by a beneficiary, but just, typically outside of the pandemic, it's a pink slip, it's a termination of employment or something like that. But they're looking to documentation of income. So you need to stay within the boundaries of 24 CFR 570-506 in terms of our documentation of the record keeping to establish having met a national objective. And usually that is, that's loss of income due to coronavirus. I don't know if we want to get into photos of positive tests and that kind of thing.
Well, yeah, there's no guarantee that it belongs to the person sending it.
Yeah.
I mean, I think with a PCR test, you have the name and, like when I took one before, it had my name and the negative, and all of that there. So they could see that I went to a doctor's office and they, did it and it was me. I mean, I could have, my poor 4-year-old granddaughter had COVID. And I mean, if I really wanted to be foolish, I could have took her test result and sent that picture. And say, oh, I can't work because I have COVID. And it's not, I don't have it. I'm using somebody else's test result. It's totally unreliable. This is something that may also require additional guidance because it's a little, it's handled a little differently. I mean, some people test positive and never have one symptom. And in some cases I've been reading, hospitals are forcing their nurses and doctors to work even with positive COVID results, as long as they're asymptomatic.
Okay.
This is a funny issue. I think it needs to be revisited in policy guidance.
Definitely. Okay, Duncan, do you have anything further on that?
No, I think that's fine.
Okay. I will take the next question. Can you reimburse mileage for an agency if the provided public service requires traveling to meet the client? Example, traveling to where the homeless are congregating to provide homeless outreach.
Well, first of all, homeless outreach is not an eligible activity in our program. I mean, but there are many services. I see a question about public services for the homeless. I mean, there are many. You can do substance abuse treatment, that's a public service, mental health counseling, job training, life skills training. I mean, there's so many different services that can be provided that are targeted either just to the homeless or to the homeless and other people. But if they target it to non-homeless, then they can't use that presumed group national objective for the limited clientele. If they do a public service that's not limited to homeless.
Okay. So that's the answer for those two questions. Here's a good one. What is eligible for transportation? Car repairs, bus tokens for city transit, Greyhound bus tickets, etc. So what would be eligible for transportation?
Yeah, okay. So typically within the CDBG program, transportation as a public service is usually handled as a discrete activity for a particular limited clientele group, usually seniors, a senior transportation service that a jurisdiction may run, or may support a local transit company running. Within CDBG-CV, transportation services. So transportation services then within CDBG as a public service is usually mass transit. Usually it's more than one person. So it's not individual vehicles. It's not car repairs. It usually is, again, for a limited clientele. If you were providing transportation services to homeless individuals, for instance, that would have to be something that they could use to, for their purposes, to get to an appointment or something. And it would have to be something that isn't tradable or could be used for something else, or could be given as a service to somebody else. So that's why tokens, bus tokens, are problematic because they're tradable. They can be, somebody can say, well, you know, I'm not going to take that bus. I'll give it to so-and-so and I'll get, you know, something else for that. Transportation services, again, is a little bit tricky then with regard to CDBG-CV public services. It usually isn't for rides, but that are to any destination, like a Greyhound bus ticket. It could, but usually it is for rides to to meet a particular need of the individual, whether it's a ride to a doctor's appointment or a ride to a to do some basic food shopping, that type of thing. So it is very limited, and typically, again, the way most of our grantees use public services, transportation services as a public service, is by establishing a discrete program where they can document the number of rides given over a certain time frame to seniors, to going to doctor's appointments, or for basic food shopping, that kind of thing. Or for paying, or even to make the record keeping even simpler than that, paying for one of the minibuses, let's say, as part of a senior transportation program or something of that nature. It just has that discrete aspect about it, and it's not so freewheeling as, you know, bus tokens for transit. Gloria, anything else you want to add there?
Only that I agree 100% that you can't, that something like this is more of an annual appropriation, CDBG assisted activity, as Duncan said, for persons with special needs. Most of the grantees that have these programs are operated exactly as Duncan said. They're to get seniors or adults with severe, that are severely disabled, to their medical appointments, to pick up their prescriptions if they can't have them delivered, and to purchase food. but under no circumstances can CDBG be used for car repairs, bus tokens, or Greyhound, but bus. These are things people, that need to get back and forth, are supposed to provide for themselves.
Okay. All right, great. Thank you, Duncan and Gloria. Next question would be, can you expand on no ongoing operations as a standalone public service? What does this mean for an ineligible public service activity?
So I think that came up. Maybe we could go back to the slide where you talked about that, Chelsea. If in terms of ineligible activities, can we go back to that slide? Yeah.
Mm-hmm.
So what we're talking about there is operating rental housing. The cost of operating that housing, the taxes and insurance and the maintenance of the facility, those operating and maintenance activities are not an eligible public service of that rental housing. Operating and maintenance is eligible as a public service only in conjunction, if the public service is in a public facility, that's providing public services. So, for instance, excuse me. So, for instance, you may have a community center operated by a subrecipient, and the only way, and that's an eligible public services, maybe the services that are being provided within that community center, and the only means of CDBG support would be the salary for the janitor for the community center. That would be it. That's an eligible public service, because even though you're only paying for operating and maintenance, but for that operating and maintenance, that public service wouldn't be able to be provided within that community center. So that's an eligible cost. That's an eligible use of CDBG. But ongoing operations as a standalone public service, where it's not connected with the provision of a public service, on operations and maintenance, they are not allowable. I hope that explains it a little bit better.
Thank you, Duncan.
Sure.
Okay. I have my next question. What happens if there are no quantifiable increase, or if there's no quantifiable increase?
Yeah.
Okay. The statute regulations require either a new service or a quantifiable increase in the level of service that was being provided by the grantee or on its behalf during the preceding 12 months. A quantifiable increase really means a large increase. I mean, we don't say in the regs or in policy guidance that a quantifiable increase is a 25% increase or 50% increase. Usually the determination of what is considered quantifiable is made by the grantee on a case-by-case basis with each public service that it intends to carry out. Now, if it decides that it wants to do a public service that already exists, but there's no quantifiable increase, then, and it's not new, then that public service may be found to be ineligible, because that is a requirement of the provision of CDBG and CDBG-CV to pay for public service activities.
Yeah.
Mhm.
There has to be, I mean, you can provide the same level of services for several years for a public service. That's fine. But if you're increasing the level of services, and you're not, or rather, I guess what I want to say is, if you're supplanting CDBG funds with other local funds that were dedicated to that service, that's not allowable. That's not considered a quantifiable increase. You're just supplanting local funds that were devoted to that activity with CDBG funds.
Okay, great. I'm going to move on to the next question. Thank you, Gloria and Duncan. If a nonprofit providing public service has been providing the same services for the same population, in example, seniors or youth, would these agencies still be eligible to receive funding every program year?
Yes, as long as the grantee wants to carry out a particular public service for any targeted population or anyone, as long as they would like to carry that activity out, they may continue to do so. There's nothing in the regulations nor the statute that says that a public service can only be assisted for 5 years, for example, 3 years. You have some grantees, however, that renew their contract with their subrecipients annually for the same activity, rather than say, I want nonprofit Y to provide tutoring services for 3 years at this location to serve this many children. Some make their subrecipients do a new agreement every year, and that's fine too.
Great. The next question, I've had a question recently from a nonprofit who assists LMI with gas vouchers, repairs, and car insurance, etc. Is this eligible for public service CDBG funds?
I would say no. Yeah, that is not, that may be ineligible, that might be a worthy endeavor, but it's not eligible for CDBG.
Okay, great.
That's
I
not an
second it.
eligible public service.
Okay, great. Thank you, guys. Okay, I have a question regarding food banks. Refrigerators, are they okay? I thought only walk-in, more permanent types of equipment were allowed only. This person has a question regarding the appliances that are used in food banks. Are food banks allowed to have refrigerators as permanent types of equipment? That was the question. That was the full question.
Chelsea, it looks like Duncan and Gloria have dropped off.
Okay. If you could just bear with me to see if we could possibly have them join again. Okay, if you all could just bear with us, several of the participants are experiencing connection issues.
Audience, please bear with us while we try to reconnect the speakers. Duncan, are you back with us now?
Yes, hi, I'm back. I think we all got disconnected there. We apologize.
No problem. I think we were just on the question about
Food banks,
food banks.
yes.
Yeah.
Yeah, so if you're going to be providing perishable food items as part of a food bag or food basket to a family or an individual, you're going to need a refrigerator, right? And so, yes, they are definitely an eligible cost as part of the operation of a food bank.
Okay, great. Thank you, Duncan. Next question, can you provide more detail on the public services cap? The attendee wasn't entirely understanding the 15% plus 15% of last year's funds.
Okay, so I think we have within our IDIS training more detailed explanation of how to calculate the public services cap because in terms of your compliance as a grantee, there is a section of the PR 26 financial summary report where you're going to have to show compliance with a public services cap. Know that with regard to public services, the cap has been lifted with regard to CDBG-CV funds used in response to coronavirus, and with 2019 and 2020 funds also used to prepare, prevent, or respond to coronavirus. So the calculation of the cap it's explained in more detailed in the IDIS presentation as part of basically CDBG. So I would refer you to that presentation when it's available as to how exactly it's calculated.
Okay, great. Thank you, Duncan. My next question, if a public service is new 1 year and the public service wants to continue it the next year, but there's no increase the second year, is that still eligible?
Yes.
My next question, can CDBG PS funds be used to pay for extended lodging at hotels during extended stays for cancer treatment? These individuals are not residents of the jurisdiction.
My apologies for getting cut off.
No, I think we all did, Gloria.
We all
So
did.
no worries.
Oh, did you? Okay,
yeah.
okay. Did y'all answer the thing about religious organizations?
Not yet.
We're working on a question right now.
I can repeat it.
Okay, I'm sorry about the extended lodging for cancer.
Yes, yes.
Yeah.
How's that tied to the pandemic?
Yeah, and I think even more so is a grantee really has to consider, how does this activity further the housing community development goals and objectives of their community, especially if it's not for residents of the jurisdiction. They would have to provide an extremely compelling case for that expenditure. So I would say no, unless you can make that case somehow.
Mm-hmm. Gloria, do you have anything further for that one?
To be honest, I don't think it's eligible at all.
Mm-hmm.
And with
Yeah, I mean,
regard to being residents of the jurisdiction,
Yeah.
that's another problem, because 57309 is the regulation that pertains to assisting activities outside of a grantee's jurisdiction. One of the requirements is that reasonable benefits have to accrue to the residents of the grantee's jurisdiction as paying for this. So no reasonable or any benefits will be provided to their residents because they're assisting people that aren't their residents. Entitlement grantees are supposed to stick to assisting activities in their jurisdiction. Now, we have urban counties that have entitlements located within, but they cannot assist activities in each other's jurisdictions just because. For example, I had a county come to me once and say, well, the city is poor and we want to help the city out, and we want to put this activity in the city for its residents. And we told the county no, because the activity, while it's located in the county legally, because the city is a part of the county, for our program purposes, the city and the county are totally separate entities. And when if the county intends to put this facility in another jurisdiction, first of all, it cannot just do that.
No.
And if you're assistant city residents, there are no benefits to your residents. Your money has to benefit your poor residents. And the city's grant is supposed to assist its poor residents. Now, they can partner together on an activity, but that's a whole different explanation altogether, which we may not have time for. But grantees that are either contiguous or when you have a case of an urban county and an entitlement in its boundaries, they can partner to do an activity, but there are a lot of things that they have to make sure they have in place. One being a separate and distinct agreement between the two that spells out who's responsible for what. The percentage of money kicked in, CDBG money that is, has to be proportionate to how, to the residents benefiting. And the county is a larger entity, so it may say, okay, we'll handle 70%, you do 30%, and they're going to have to be careful trying to document that to ensure that 70% of the beneficiaries come from the county and 30% come from the city. So like I said, that's a whole nother ball of wax altogether.
Yeah. Let's move on to the next question.
Okay. I have a question. Can you state the regulation relating to religious organizations?
It's 5/100. They moved it. It used to be 575, 200J, but they moved it to 5/100.
5.100, Gloria?
Yes, and actually,
it's
since I have the
24 CFR 5.100, right?
yes, my apologies. I'm so used to just quoting regs. And I have to forget that I'm not talking just to you all. I'm also talking to grantees. So please pardon me for that.
Okay. My next question, building container homes for foster care children aging out with no place to go. Would this qualify?
Yeah. So I think you would need to consult with the folks that you've been working with on the youth homeless demonstration program for this population group. I would encourage you to do that. They can better answer that question and the eligible configuration of how you could use CDBG for that particular population. But anybody who is, an individual or considered a family, a household, if they're low and moderate income, they are considered, eligible for housing. But again, it's not necessarily a public services question. It's more of a housing question. And you probably want to work with the people who've been working with you at HUD on that youth homeless demonstration program for help on that one.
Mm-hmm. Great. Thank you, Duncan.
Okay. I'm sorry to butt in again. I wanted to point out that we have said in the past with regard to any services directed to foster children and only foster children, as long as they're residing with their foster families for our purposes of determining a national objective, they're considered one-person families. They're not considered part of the family with which they're residing. When they age out, then they are considered just like any other person would be considered with regard to services and meeting a national objective. I mean, you can have, let's say, a counseling program or some other program that's targeted to this population. And as long as the citizens are aware of that, it can go forward, but national objective compliance is still determined, whether or not these people are LMI. Some of them may be, some may not.
Mm-hmm.
One more clarification. I looked it up. It's actually for the religious entities. It's 24 CFR 5.109. I knew it was in the 100s, but I didn't, it's specifically 24 CFR 5.109.
Okay, great. Thank you, Gloria, and thank you, Duncan. My next question, how would you document a transit project if you're only allowed to serve clients who reside within your CDBG service area?
Well, again, I'm assuming you're providing transportation public service for a limited clientele in that reside within your jurisdiction. So you would work with an agency that has these individuals register. They show proof of residency, and they're the only ones who are allowed to use the service, that transit service. And again, this could be, as we explained earlier, with senior transportation, it could be a fleet of minibuses that take people to doctor's appointments or to help them fulfill the needs of basic living, such as grocery shopping, that kind of thing. So you document that by making sure that the people who use the service were somehow registered or signed up through some type of intake form, what have you.
Okay, great. Thank you, Duncan. My next question, we are considering a Prepare For program designed for persons with at least one of the pre-existing conditions listed by the CDC that pose a greater risk for fatality. Is it okay to have a form completed by a doctor that certifies the applicant has one of the conditions without specifying which ones? Would we also need to document something on the doctor who signs the form?
I presume that this means the grantee intends to provide public service only to persons with a pre-existing condition or what they call comorbidities identified by the CDC. They would have to document that if this is the population that they're serving with this activity, the citizens have to be notified. When the grantees do their public hearings and comments on the action plan and things of that nature, they have to be advised that certain activities may be designed only for a specific population and given a chance to comment on that. And those comments have to be attached to their plan when they, submit it. That said, they are required to ensure that after that has been completed, I understand the HIPAA laws, and that they can't release information. However, if the person wants to disclose it, the form can state that they're aware of the HIPAA requirements, but choose to disclose anyway. But there has to be a way of identifying that they are, have been diagnosed with one of these pre-existing conditions. I think diabetes is one, obesity is another, and that one's controversial because, it's not viewed the same way by everybody. But a doctor would have to certify that the person suffers from one of those conditions if it's the targeted group.
Okay.
Does document something on the doctor who signs the form? No. No, they need certification from their doctor that they suffer from one of, and they can say, yes, they have one, but it's not disclosed because of HIPAA requirements.
Mhm. Okay, great. Thank you, Gloria. My next question, HUD did issue an FAQ on religious organizations in November of 2021. Is this a reliable guide to determine eligible uses?
That may have been issued by our Office of Faith-Based Housing. I'd have to look at it personally. Duncan may know.
Yeah, frankly, yeah, I'm not familiar with the guide, but
Yeah, I'll try to see if I can.
but I would assume, if it's of a recent nature, it would be a really reliable guide. But with regard to assisting religious organizations, you do have to be careful that there's a separation of the actual provision of the public service and any religious instruction, proselytization, that type of thing. That the public service isn't being provided in the same setting as that religious instruction or proselytization, or as a condition of receiving religious instruction or what have you.
Great. I'm going to move on to the next question. I know Gloria did say she was going to do a little research on that FAQ.
You said it was a FAQ or a no? Okay.
Yes.
I don't know.
I think I just briefly looked at the guide that was posted, and yes, I think that's the guidance there is in keeping with our regulations. Yeah, so it should not be. You can follow that guidance in terms of determining what religious organizations can and cannot do.
Okay. Next question. Can you talk a little bit about using CDBG-CV funds for fair housing?
Well, I would say that's a little bit that may be a little difficult. As you know, in the annual formula program, CDBG, fair housing is considered, most fair housing costs, use of funds, are a program administrative cost. They would fall under your planning and admin cap. So it's not really a public service. It's considered an administrative cost of the program. For you as a grantee to ensure your compliance with affirmatively furthering fair housing. So the use of CDBG-CV funds, insofar as you need to spread the word about fair housing, like much of your fair housing funds under the planning and admin cap would be spent, and your means of doing so has been limited in some degree by the pandemic, I suppose you could find a reason for using CDBG-CV funds in that case for fair housing, but you'd have to probably be able to be a little bit more specific as to what you were planning, what exactly was the use of fair housing in connection with the pandemic and addressing the pandemic and addressing coronavirus. and I would encourage you to contact your field office if you had some questions about the specific fair housing activity you're thinking of engaging in.
Great. I'm going to move on to the next question. We are planning on using CDBG-CV to fund vision and dental checkups for uninsured, low, moderate population whose incomes have been affected by COVID. We plan to use a self-certification like we do in our rental assistance programs. Is this okay? Is it okay to use self-certification?
So I can answer this one as well. Self-certifications are fine. I do want to reiterate, though, that these need to be verifiable self-certifications. Our regulations in 570-506 do indicate that self-certifications are an acceptable means for providing income eligibility, but they need to be verifiable. So you probably, you want to use self-certifications. There is some caution in using them because, again, with regard to CDBG-CV, we all know that the Government Accountability Office and the HUD Office of Inspector General have a keen interest in preventing fraud, waste, and abuse with these funds and in ensuring that they're spent correctly. So, self-certifications, you need to have some means of checking a certain amount of them or a certain percentage of them to verify that people's income is what it is. So they ought to be verifiable to some degree. There is more guidance on the use of self-certifications found within the CDBG FAQs on HUD.gov and on the HUD Exchange. We would suggest to you that if you're using self-certifications for rental assistance, and then you're thinking of using self-certifications for this other public service, that you develop a self-certification policy and procedure, and how and for what types of activities you're going to be using them for, and how you're going to ensure that they're verifiable, if that should be needed.
Okay, great. Thank you, Duncan. I have another question. If we are reimbursing a subrecipient for case management, an example, salaries and fringe benefits, for an eligible public service, do we review 24 CFR 570 or 2 CFR 200 to confirm allowable and allocable, costs, or both allocable?
Okay. Okay. 2 CFR Part 200, starting with 200.400, that concern cost items and what's eligible. That's important. The words case management, though, raises a flag in CDBG, because case management itself is not an eligible activity. However, the salaries and fringe benefits for, let's say, nonprofit employees that are providing a direct public service to ensure that the costs are okay, they would go to 2 CFR Part 200. 570 just tells you public services are eligible. There is no detail there.
Yeah, I mean, case management in connection with an eligible public service is an eligible cost. If you're providing if you're providing services at a senior center, and one of the services you're providing is social services for seniors, you've got case managers on your staff that have a group of seniors that they're working with. They all have individual case files, and their salary and fringe benefits are eligible because that's a part of the cost of providing that public service. So case management, I think what Gloria was referring to, just case management as a standalone activity is not eligible. But case management action with an eligible public service and the salaries and the fringe benefits of those employees are eligible. And you'll find that in that section of Part 200, those salaries and fringe benefits are eligible costs.
Yes, Part 200 identifies specific items of cost such as advertising and bad debts and all kinds of things. And it's under I, which is compensation, when it talks about compensating employees.
Yeah.
That's a resource you can use. And that's where it talks about salaries and fringe benefits and things like leave and all of that that's tied to a salary and its eligibility, and that it has to be documented. But Duncan's correct. Case management is standalone, is something that they can do in ESG-CV for homeless persons. And we have grantees that try to do that same type of case management that the ESG-CV does for homeless using CDBG-CV, and it's ineligible. They do street outreach, which is part of that, and that's not an eligible activity in our program. Therefore, for lack of a better term, that's why we don't use the term in our program, because it may trigger the ESG CV eligible activity with regard to case management.
The salaries and the fringe benefits of the employees providing the public service are eligible. So let's leave it at that and go on to the next question.
Okay. Can CDBG-CV be used to implement an on-site school pantry for kids and their families as an area benefit or a limited clientele activity?
On-site school pantry. So, wow. Yeah, so a food pantry, I'm assuming this is a food pantry. It doesn't note that, but that this is a food pantry that is at a school. So it depends on the population of that school as to whether it would be an area benefit or a limited clientele activity. And you know, what we do instruct you again is that you do try to seek to fulfill that national objective, which is the easiest for you to document within reason. So if you know for certain that the school serves a low mod area that's 51% or more, and that nobody attending the school is, you know, that the population of the school as a whole is 51% or more low mod, you could do it as an area benefit activity, which is the catchment area for that particular school. Unfortunately, most schools are not set up that way. So, but if you're able to document that, again, documentation, if you're able to document that, then you could pursue an area benefit national objective. If you're not able to do that, limited clientele would be the way to go to pursue a national objective for that activity.
Okay, great. Thank you, Duncan. I have another question. If CV funds are provided to a food bank to assist in distributing food, an example, delivery of food to sites or homes, what documentation should be collected to show the activity is benefiting LMI?
Okay, we're back to document.
Documentation.
Yeah, sort of like location, yeah. Like when I talked about record keeping, yes, it's very important to document as much as you can. So that, yeah, but anyway, let's say that they're delivering food to homes. Now, during the pandemic, the elderly, especially in the big, they were considered to be more vulnerable to the effects of COVID than the general population. So some grantees were actually distributing food, not only to the elderly, but adults with severe disabilities that weren't able to retrieve food, and others, you know, people receiving cancer treatment, for example, that would have a worse outcome with COVID.
Yeah.
And so if let's say if that's who you're assisting when you're taking the food to homes, you have to document the income of the people that you're serving, that you're taking the food to.
Yeah.
And you can use self-certifications. I mean, for activities that are not what we call high dollar cost activities, like this one, food bank, which generally isn't, self-certifications are great. And the person can just certify, you know, their income. And we always recommend that grantees have a statement at the bottom saying that this information is subject to verification by HUD at any time. And it's important that that's where they sign so that they're aware that their application may be chosen by HUD for verification. But if they're distributing it to sites, let's say they're distributed to other, you know, like you have the Capitol Food Bank in DC distributing to the food banks in various wards of Washington, DC, they have to show that those sites serve a low and moderate income clientele.
Yeah. I mean, I think with regard to meeting a national objective with a food bank and this type of activity in particular, you can also document with regard to a site, nature and location, with regard to the use of CDBG-CV funds. We've established that with a couple of groups of grantees around the country, and that it's fine to use a nature and location national objective for that particular activity.
Great. Thank you, Duncan and Gloria. My next question. An agency is applying for training to establish an in-home childcare business. In order to get the individuals started in the in-home daycare, they would need the funding to establish the training. Is this a public service?
That's a good question. I think it's probably more a micro enterprise. It could be even a economic development activity. The use of CDBG funds would be to assist a business. So that might be an economic development activity, not a public service. Yeah, public services are nonprofits. So an individual Yeah, that I think is an economic development activity.
Okay. All right, thank you.
Anything to add on that one?
I agree it would be better as a micro enterprise activity under 24 CFR 570-2010. And that's because for the cost of establishing micros and also peer support, training, childcare, for the person receiving the training. And all of that is part of the eligible cost of assisting with setting up or helping someone set up a micro enterprise, which is what this would be, particularly if it's just this one person or if it was this one person and an aide providing the in-home daycare services. And see, those activities when provided under 2010, the ones that I identified there, the peer support, training and so forth, those are not considered public services under the cap, but in conjunction with the system of micro enterprises 2010.
Yeah.
Okay, great, thank you. My next question, for presumed benefit clients, does the public service provider need to provide race and ethnicity data for clients served?
So presumed benefit, if you look at the guidance in IDIS and the guidance we've provided in the IDIS online manual, you'll note what we assume with regard to presumed benefit clients with regard to the income questions in IDIS. As far as race and ethnicity goes, I would defer you to those activity setup screens in IDIS. But typically, yes, we're looking for race and ethnicity data from our clients. They shouldn't be compelled to provide that, but that should be an optional question or a question that a public service provider can obtain the answer to by observation or what have you. It's not that critical, but that is requested for most of these activities in IDIS, yes.
Okay, great. Thank you, Duncan. My next question, will CV funds be used to pay for packaged meals provided by a nonprofit drop-in center?
So again, this comes back to who's the clientele of this nonprofit drop-in center? How are you establishing national objective for the people who use this drop-in center? Is it on an area basis? Is this a limited clientele population that uses this drop-in center? Is it just anybody in the neighborhood? Once you're able to establish, who is using, who the users of the center are, you can determine whether packaged meals, whether that's an eligible expense. If, let's say, this is a drop-in center for teenagers in a neighborhood, and the neighborhood is low and moderate income, and the drop-in center service area is within that low and moderate income neighborhood and is pretty much exclusively within that low and moderate income neighborhood, then yes, packaged meals at that drop-in center, they would be an eligible public service expense.
Yes, and don't forget.
regard to the use of CV funds. I'm sorry, go ahead, Gloria.
I'm sorry, Duncan. I thought you were done. I was gonna say, don't forget that providing these packaged meals, as in this question, has to be tied back to the pandemic.
Right, yeah. That's where I was going.
Oh, I'm sorry. I didn't, okay.
No, that's quite all right. Yeah, with regard to the use, if you're talking about CDBG-CV, which the questioner is here, then yeah, you have to show tieback. What's the tieback as to the provision of this, of these meals? What's the tieback to coronavirus?
Yeah, I mean, did the parents, all the parents in that service area, most of them, did they lose their jobs? And you know, this is their only way to eat. I mean, you know, you have to be able to tie it back to PPR.
Yeah.
Okay, great. And I'm going to the
Yeah, go ahead,
question.
Chelsea.
Can you cite the CFR regulation regarding self-certification so the participants will be able to research?
There's not a lot there, but it's 24 CFR 570 506B is in boy. It's a very long paragraph that talks about what the grantee can provide to demonstrate national objective compliance. And the relevant part to that question says the assisted person, or recipient may substitute a copy of a verifiable certification from the assisted person that his or her family income does not exceed the applicable income limit established in accordance with 573.
Right, 570.3, not 573. Yeah.
I'm sorry. I usually don't say the dot. Like I'll just say 572.
Right. Yeah. And 24 CFR 570.3 presents the definitions of income under the CDBG program.
Mm-hmm.
Yes.
Be able to repeat that
Sure.
for me, please? Thank you. Or
Go ahead,
John.
Gloria.
24 CFR 570 506B is in boy.
Okay. Okay, thanks, you guys. I'm going to.
And again, in the questioner, Maureen, I guess, is the person who's asked that question. We would also encourage you to reference the self-certification guidance on HUD.gov and the HUD Exchange in our FAQs, and also, you know, think about self-certifications and the use of them in a holistic manner, and, you know, establishing a policy for their use in what types of situations, et cetera.
Great. Thank you, Duncan. Thank you, Gloria. Okay, if an economic development activity is using LMJP as the national objective, do you still need income data for each individual job or person hired? Or can you identify all income to be low as the presumed income level in IDIS?
Okay, well, this is not the economic development session, it's the public services session. But so I prefer that the person would ask that question also in that session. But what you need to establish is the income data for the individual job or person if you're using CDBG-CV. If you recall, if you've you've read the CDBG-CV notice. HUD has established some program flexibilities with establishing LMJ qualification that you don't have to document the household income. You just need to document the salary of the job is a low and moderate income job, that it's you would regard the person as a family or household of one, and use the low and moderate income limits for a one-person household to establish that that's an LMJ job. Yeah, so I don't know if there's anything you want to add there, Gloria. I think that.
Okay, I'm looking, okay, what I did was I looked it up. I mean, they'll get more information during the economic development session,
Right.
which will be tomorrow morning. But in the meantime, the regulation for LMJP is 24 CFR 570 208A4 little 4 in Roman numerals. And it says, for purposes of determining whether a job is held by or made available to an LMI person, they can be presumed to be LMI if one of these conditions is met. And what they'll need to provide is documentation that one of the conditions is met. I thought I got cut off again. Okay. They have to reside within a census tract or block numbering area. You know, it tells you, rather than read all these regulations to you, it's better to tell you to look it up. With regard to CV, Duncan did give you the exceptions already. With regard to documenting LMJ for CV economic development, but the economic development presentation will give you a lot more detailed information on that.
Okay, great. Thank you.
Yeah, but they can look at, you know, in the meantime, they can look up the regulation to see what is applicable for the regular or annual appropriation CDBG program.
Okay. All right, my next question. Can you provide CDBG funds to help acquire a property for the purpose of childcare, whereby we would contract out to an accredited childcare business looking to expand services to serve low moderate clientele? We are thinking of a childcare business that has primarily been doing home childcare.
This is one of those, we need more information to provide a comprehensive answer type of questions. So I'm presuming the grantee would acquire the property using, here it says a regular CDBG. And once they acquire this property, they're gonna get a childcare business. I presume to train people so that they can provide childcare to serve more LMI clientele. I mean, it's one of those that needs more information and a really comprehensive answer.
Okay.
Yeah.
Well, the participant has time to resubmit their question if they would like.
Before we go on to the next question, Chelsea, just to follow up on the earlier question about whether race and ethnicity data need to be, attached to public service entry in IDIS, when you're setting up that activity. It does need to be entered in among the accomplishment data that is entered. And again, your intake forms for your public service activities that you're providing, they should ask for that data. And again, follow the guidance that is found both in IDIS and within the income calculator that we have on the HUD exchange. For federal government purposes, there are only two ethnicities. There is Hispanic and there's non-Hispanic. Those are the only two ethnicities that the federal government recognizes. You should all know that from your census form. So, and then with regard to race, that information is all there, in terms of multiple combinations and what have you. But yeah, that information is required to be entered into IDIS.
Great, thank you, Duncan. All right, and my next question, I was the one that asked about CDBG-CV and fair housing. We were interested in using funds because increased eviction cases that will need to be taken to court. Also for advertising, education, and outreach.
Usually educating residents about their fair housing rights is done as a planning and admin activity, where they hold, fair housing fairs and different things where they have events, public events where they may hand out information and have a speaker and so forth to provide public information. And that's under 570-206C as in cat, where it talks about provision of fair housing services designed to further the fair housing objectives of the Fair Housing Act. And it has some other stuff listed here. As we said before.
If I could just interject too, Gloria.
Okay.
Fair housing laws are set up for protected classes.
Mm-hmm.
Your eviction due to inability to pay rent does not make you a member of a protected class. It just makes you unable to pay. So I would consult with folks in FHEO who may know more about eviction as it relates to fair housing. There may be some crosswalks between eviction and fair housing with regard to the pandemic. That's probably beyond our knowledge base at this point. But typically, inability to pay does not make you a member of a protected class. Now, this differs in different jurisdictions all over the United States. Certain states have several dozen protected classes when it comes to fair housing. Certain states only have the list of federal protected classes. So it may also be dependent upon your situation, where you are, what state you're in. So I would consult with the FHEO people in your state to see about the use of CV funds and whether eviction due to CV makes you part of a protected class. I think I want to leave it at that and have you discuss this with people in the FHEO office, that covers your jurisdiction.
I was on mute. Thank you, Duncan, for that.
Sure.
So as of now, there are no questions in the queue, but if you are willing, Duncan and Gloria, we can stay on the live webinar for a few minutes just to see if anyone might have any further questions or if we might get a question resubmitted or not. You just let me know, that would be fine. Okay.
Yeah, and so I would just want to reiterate while we're waiting for any more additional questions, that there are several resources to assist you regarding public services and their use. Please go to some of those resources that were mentioned in the slideshow. The PPR tieback quick guide that was provided in April of last year is a very valuable resource. And also another one that I want to point out is the well, can't seem to put my finger on it right now, but there is a CDBG-CV toolkit that speaks to public services and their use, and especially emergency payments. And you can find that CDBG-CV toolkit on the HUD Exchange as well. So encourage you to go to there and use those resources.
Okay, great. Thank you, Duncan. Okay, looks like I have another.
Gloria, do you have something else that you wanted to add with regard to fair housing?
I take it she does not.
There is a link, maybe a link in the chat.
Okay. I do have a few more questions, Duncan, if you're ready to assist with that. Gloria is providing links.
Yeah, oh, okay. So there was a question that was asked about undocumented individuals, and I think we will address that only to say that the guidance that we're operating on is the guidance that was agreed upon between the Department of Justice and our agency, and that's the guidance that we're using. You can Google that and find that. There is a link in the chat to that, that's the established guidance that we're operating under.
Okay, great. All right. My next question, are there any CDBG funds that could be used to support an eviction diversion project?
Eviction diversion project. Again, you'd have to somehow make eviction diversion an eligible activity within the CDBG program. CDBG is able to provide housing of last resort to certain individuals In most cases, housing of last resort is used in the annual formula program with regard to assisting individuals who have been involuntarily relocated under the Uniform Relocation Act. It's not used in an eviction situation. So I think you'd want to discuss exactly what this eviction diversion project does and whether it aligns with a potentially eligible CDBG activity. I'm not certain.
Okay. Thank you, Duncan. Gloria, do you have anything to say to that? Okay, I'm going to move on to the next question. Can CDBG funds be used for costs associated with youth sports programs in low, moderate income areas? Also, is self-certification necessary for each participant?
So this would be under recreational services. Recreational services are an eligible public service in CDBG. So the costs of providing that service would be an eligible cost. If you're going to do it, again, in a low mod area, you need to be certain that that the persons participating are residents of that area. I had a situation where, as a grantee, we were funding for a number of years a youth basketball league until it became apparent that most of the people who attended this youth basketball league were residents of a neighboring jurisdiction and not residents of the jurisdiction which was supporting it with its CDBG funds, namely mine. So we had to cancel that activity. And we reprogrammed the funds to another activity. So you have to be certain that the folks participating are part of that service area. And again, it's probably easier for you to do that on a low and moderate income area basis, based on a low and moderate income service area, rather than obtaining a self-certification from each participant. But if that's what's needed, if you can't establish it based on low or moderate income area, a self-certification would suffice. Make sure that some percentage of them is verifiable, that they are verifiable. Should you need to come HUD monitoring or audit time, be able to verify those self-certifications. Yeah.
Okay, great. Thank you, Duncan. Is there a list of eligible items a food pantry can purchase with CDBG funds?
List of eligible items. No, not necessarily. I think food pantries typically know what they need to operate, so they can determine whether those costs are necessary and reasonable for the operation of a food pantry, and check that against 2 CFR 200. I'm trying to think of a cost that a food pantry would incur that would not be eligible. There may be some things like vehicles, certain vehicles or equipment that may not be eligible, but check it against 2 CFR. And remember, I think when we got cut off earlier, I was answering a question about refrigerators in food pantries, I think. And refrigerators typically for a food pantry, less than $5,000 in cost, they would be considered a supply, not a not a piece of equipment for that food pantry.
Mhm. Okay, thank you, Duncan. I do have another question. Do you have a good resource that shows eligible uses for public services, CDBG versus ESG?
So what the questioner, I think, is looking for is like a crosswalk that shows, you know, aligns public services and CDBG and ASG and shows what's eligible, ineligible, that kind of thing. I don't know if we do or not. We'd have to get back to you on that or not. I don't have a good answer for that one. The answer is I'm not sure. I don't think such a resource exists, but we can get back, you know, in the post conference follow up on that one.
Definitely note that. Okay, last but not least, please provide again the income calculator reference.
Okay, so the income calculator can be found on the HUD Exchange. I don't have a direct link available. If you Google CDBG income calculator or CPD income calculator, you'll find the link to it on the HUD Exchange, and you'll be directed directly to it. And that's always being regularly updated.
They've been provided the link in the chat.
Okay, yeah. So CDM has provided that link, which is great. Thank you.
Yes. Okay, I have another question. Welfare is listed as an eligible public service, but what is welfare defined as?
Yeah. Welfare services are, again, think back to the creation of the CDBG program. CDBG came in to effect in 1974 when there were such a thing still as welfare agencies. There are not that many welfare agencies out there any longer in the post-AFDC world. Welfare was defined as a set of social services tied to the provision of assistance to a family or individual to get back up on their feet. We don't actually define welfare within our regulations. So again, if a welfare activity is something that you're considering engaging in, you'd have to be able to document that for us and determine what you mean by that. We don't define welfare services. I do also want to mention here, with regard to any public service, we do understand, given the nature of the pandemic, that there may be some public services that agencies engage in which are uncommon with regard to the use of CDBG funds, which is why we did leave it open-ended and we did not restrict the use of CDBG funds to address coronavirus to any particular activities. So as long as you're able to document the tie back to coronavirus, that it's eligible and that it meets a national objective, and you have those three, you should be in a good spot. And remember that these funds are coming under increased scrutiny from the Government Accountability Office, from the HUD Office of Inspector General. So be certain that you've made a good case for the use of CDBG-CV in whatever instance you're making your case for.
Okay, great, Duncan. All right. I want to, of course, conclude the webinar, and thank you, Duncan and Gloria, for assisting me today with the questions and answers. I also want to thank the participants and the attendees for their support and their help with this. We are going to end the live conference now. It is 5:59 on my clock, and I'm hoping that everyone enjoyed the session. And I know that were some questions that were not able to be answered, but we do have different resources available. And you can also reach out to your field offices to have questions answered. And with that, I am ending the webinar. Thank you.
Good.